So as we know, PCSK9 inhibitors work mainly by preventing the degradation of LDL receptors. So they allow for more LDL receptors to take up cholesterol from the bloodstream. So one area where it was uncertain whether PCSK9 inhibitors would work or not is patients with homozygous familial hypercholesterolaemia, because in theory they should not have any LDL receptors. However, we do know that many patients, in fact the majority of patients with homozygous FH, have what we call defective LDL receptors, not absent. They have receptors that don't work quite normally, but they may have some function. So it was really an unanswered question whether PCSK9 inhibitors would work in homozygous FH. So what we first did was perform a small proof of concept study with just 8 patients, and we showed that 6 of the 8 homozygous patients did have a response to PCSK9 inhibitors with an mean LDL reduction of about 16%. So on the basis of that proof of concept study, we now present the results of the TESLA-B study, which was a larger study in which we enrolled 50 patients, and this was a double-blind study. So for 2 patients received evolocumab, the PCSK9 inhibitor, and 1 patient was randomized to placebo. And interestingly now, with this bigger study, which involving 50 patients, we found a reduction in LDL cholesterol of about 30%. When we corrected for placebo, the reduction in LDL cholesterol was about 39% overall in this patient population. Now, interestingly, what we also did was we looked at the patients that had true receptor negative mutations. There was only 1 such patient, and he did not respond to evolocumab. We then looked at the patients who had 1 defective and 1 negative receptor, and their response was intermediate. And the best responders were those homozygotes who had 2 defective mutations, and they had a very good response to evolocumab with an average reduction placebo corrected of about 47% in LDL cholesterol.